Mr. Chair, and thank you, Secretary Vilsack, for your testimony here today, as well as for your leadership on these very important issues. In the limited time that I have, I was hoping that we could just drill down some on the childhood obesity problem that we've got in America. Now, more than 1/3 of children in the United States are considered overweight or obese. Is that correct?
Yes.
And is it fair to say that this level of obesity is a national epidemic?
It's obviously a serious concern.
And so obesity places children at greater risk of heart disease. Is that correct?
That and other chronic diseases.
A greater risk of respiratory illness. Is that correct?
I'm not sure about that, but certainly diabetes, hypertension.
Greater risk of liver disease?
May very well be.
Okay. Stroke?
Greater risk of illness. I'm not a doctor, so I don't want to go, and I did raise my hand to tell the truth and nothing but the truth, so I want to make sure.
In fairness, he did.
Is it fair to say that childhood obesity increases the likelihood of bullying in school?
In my personal experience, I would say that's probably true.
Does it increase the likelihood of social isolation?
Yes.
It's fair to say that childhood obesity increases the likelihood of severe emotional distress?
I wouldn't be surprised if that weren't true.
Okay. Now, the healthcare cost of obesity per year in the United States is as high as $147 billion. Is that correct?
I'm not sure what the number is, but I know that there's a significantly high rate associated with obesity.
Right. So, in your view, if you could just speak to some of the efforts that the Department of Agriculture has undertaken to address this epidemic of childhood obesity and the severe financial, health, emotional costs connected to it.
Improving the WIC program to focus on fruits and vegetables that kids might not otherwise consume, working with the SNAP families to allow them access to fruits and vegetables at farmers markets and the EPT, 5,200 farmers markets, working on the expansion of the summer feeding program, 23 million more meals than when I became Secretary, focusing on improved school lunches and school breakfasts in terms of the standards and the calories to make sure that kids are getting nutrition, but not something that is unhealthy for them.
And last question, in your view, has the implementation of the Healthy Hunger Free Kids Act of 2010 effectively addressed the problem of childhood obesity?
I think it's a component, Congressman. I think that the issue of exercise and physical activity is an equally important component to all of this. They are balanced. You have to have both of them. It's not just calories in, it's also calories out.
Thank you.
Gentleman's time has expired.